Hello, my name is Dr. Sherry Johnson. I'm the director of the University of Wisconsin Population Health Institute. Across the country, there's growing recognition of clear and alarming link between racism and health. Numerous states, counties, and cities, as well as institutions like the American Public Health Association, have declared racism a public health crisis, and substantial research confirms this link. Racism fundamentally shapes our economic, social, and physical environments, which ultimately impact our ability to live long and healthy lives. How must we, as public health advocates, community leaders, and decision makers respond? We must learn the truth about our history so that we don't continue recreating injustice, and we must take actions toward healing. So I'm excited to announce our Advancing Racial Equity webinar series. This series is brought to you by two UW Population Health Institute programs, County Health Rankings and Roadmaps, and the Mobilizing Action Toward Community Health Group, better known as MATCH. Throughout the series, we'll feature national and local leaders joining us in our commitment to naming racism as a contributing factor to poor health outcomes. You can expect to hear from experts like Dr. Renée Canady from the Michigan Public Health Institute, T. Gonzalez from the Center for Health Equity in Louisville, Kentucky, and Jonathan Heller, founder of Human Impact Partners. They'll share insights from their community's experiences in advancing racial equity and equip you with tools and strategies you can bring back to your community. We encourage you to join us for both of these webinars and for the discussion groups that will follow each webinar, where you can ask questions and exchange ideas with others. For more information about the Advancing Racial Equity series, visit our website, countyhealthrankings.org, at the bottom of your screen. Thank you.
Welcome to Declaring Racism as a Public Health Crisis. This webinar is the first in a two-part series called Advancing Racial Equity. Hi, my name is Erica Burrows-Girardi, and I'm a Senior Outreach Specialist at County Health Rankings and Roadmaps. And today I'm joined by colleagues who will be helping to facilitate your learning throughout this webinar. I want to start by introducing you to Selma Ali. Selma is a community coach with Mobilizing Action Toward Health Equity, better known as Dr. Johnson says, better known as MATCH. So Selma, thank you for joining me today, and how are you?
Hello, Erica. Thank you so much for having me, and thanks for everyone for joining us. I will be chatting with you in the chat box. Feel free to interact with me and other guests. However, if you have any questions, please place them in the Q&A box, where Joanne Lee with Healthy Place by Design will meet you there. Hi, Joanne.
Selma, hi Erica, and hi everyone across the country. I'm so glad to be here. Appreciate, Selma, that you really made a point to ask folks if they have a question for the presenters as they're listening during today's webinar to please put it in the Q&A box. So we're separating the Q&A in the chat, and I'll be monitoring the Q&A and trying to answer as many questions as I can. I expect we're going to get a lot. And then I'm also going to be keeping track of questions for presenters. So please don't wait. You don't have to hold your questions until the end, but as you think of them, go ahead and put them in the Q&A box. Now I want to introduce all of you to James Lloyd. James Lloyd is our wonderful technologist who really works magic to make sure that all of the logistics for our webinars go smoothly. Hi, James.
Hi, Joanne. Thank you so much for the introduction. And my name is James. I'm with County Health Rankings and Roadmaps. And it's really my honor to be able to help provide support for this topic and these other topics. If you have any questions with technical issues, please send the message to the panelist chat, and I'll be watching that and do what I can to help out. So with that, I'll toss it back to you, Erica.
Thank you so much, James. And I couldn't agree with Joanne more. We really need you, and we so appreciate your support with these webinars.
Happy to help.
Yep. And now I'd like to introduce you to our stellar guest today. I want to start with Dr. Renée Canady, who has served as the CEO of the Michigan Public Health Institute for nearly 8 years. Hi, Dr. Canady, welcome.
Thank you, Erica. It's really great to join you guys. I'm looking forward to the dialogue.
Awesome. Also joining us from the Michigan Public Health Institute is Jannah Bierens. Jana is a health equity consultant at the Institute's Center for Health Equity Practice. Hi, Jana.
Peace and greetings, everyone. Thank you for having me, Erica. I'm so excited to be here.
Well, I appreciate you. And last but not least, I'm excited to introduce you to Jennifer Harris. Jennifer is the Equity and Research Program Manager at the Office on African American Affairs in Milwaukee County. So Jennifer, thank you so much.
Well, thank you for having me. Excited to be here today.
And I want to ask you all to please take some time to read more about these ladies' impressive biographies. They're going to be, those biographies will be included on a resource guide that will land in your inbox tomorrow. And I will tell you, these introductions are so stellar and just so stunning that if we took time to read them out, they're just so impressive that we would not have time for the webinar. So we can't do it. We just can't. But promise me that you'll actually go ahead and read those. So I want to take a moment to introduce some of you to County Health Rankings and Roadmaps. Chances are there are some of you in the audience that have been with us for months and really know all about us. But James told me that we had over 2,030 people registered for this webinar. So chances are there are probably some of you who are new to us. So I just want to take a moment to tell you a little bit about County Health Rankings and Roadmaps. And you'll probably hear me call a CHR&R. But County Health Rankings and Roadmaps is located in the University of Wisconsin Population Health Institute. We have several partners that help us do the work that we do, including these webinars. Match is one, you heard about them, and Healthy Places by Design, where Joanne is located. But the Robert Wood Johnson Foundation is also a key partner in the work that we do. And CHR&R is committed to improving health outcomes for everyone. Evidence shows that as a society, we can't improve health outcomes for all without that commitment to equity. Therefore, we at CHR&R are very much committed to advancing equity because everyone has a right to thrive, no matter the zip code they're in, the color of their skin, their age, or any other aspect that makes us unique. So we here at County Health Rankings and Roadmaps, CHR&R, we provide data, evidence, and guidance, as well as stories to help you create change. So that way everyone in your community has that opportunity to thrive. For more information about what we do, I encourage you to watch last month's webinar, which is called our CHR&R 101. This webinar gives you an overview of all the work and what the tools and resources that we have to offer here at CHR&R. So take some time to do that to learn more about us. And again, a link to that webinar will be included in your resource guide. And now I actually want to ask Selma to reintroduce you to Match, and so you can learn a little bit more about what it is that they do. Selma.
Thank you so much, Erica. And we want to say that we are super excited to be partners in this two-part series. As y'all know, MATCH stands for the Mobilizing Action Towards Community Health. And our research and work really focuses on health equity, community, collective community action, health in all policies, power building, and organizational and policy and systems change. Through a field building approach, we work to evolve practice, focus priorities, and shift power to support collective action on root causes of health and equity. And we do that through three strategic areas, that's training, alignment, and engaged research and development. Again, thank you so much for having us.
Thank you, Selma. And as you can see, the work that Match is doing just really aligns with what it is that we're doing, and they make the perfect partners for this webinar series. So thanks for that, Selma. But Let me shift the conversation for the reason for this webinar, and that is racism. According to CDC's Racism and Health website, racism is a system of norms, practices, policies, and structures that assign value and determine opportunity based on the way people look or the color of their skin. Racism shows up in multiple ways. It can be interpersonal, it can be structural. Either way, it prevents those affected by racism from attaining their highest level of health. Here's a image of the county health rankings model. And this model displays the multiple factors that influence health. You'll notice that we have these factors organized into 4 buckets. And I'm just curious about which buckets do you think racism limits opportunity to the most? I'm gonna ask James to launch a poll for us. And let me know what you think. Does racism limit opportunity to health behaviors, clinical care, the social and economic factors? Is it the physical environment? Is it all of the above? And while you're working on it, let me tell you a little bit more about the model. To the right of the model, you will see some measures, and these are the measures that we have associated with these 4 buckets, and these are the measures that we use with our county health rankings. To the right of the factors, you'll see how we are showing through the model that effective policies and programs can influence health factors, which ultimately influence health outcomes. So let's, James, I'm gonna go ahead and ask you to go ahead and end the poll right now and just display the results. Oh, and we see that the majority of the audience, or responders rather, 91% chose all of the above. Well, you're absolutely right. If you chose all of the above, you're correct. Racism limits opportunity to all 4 buckets. Research shows that racism is so embedded in our norms and practices and policies that people affected by it can struggle to reach their optimal health within any one of these 4 buckets, or all 4 of the buckets. That is why Dr. Rochelle Walensky, the director of CDC, has declared racism a serious public health threat. Let us know in the chat if the city that you live in, or the county, or the state, or even the institution, organization that you work for has made such a declaration. And don't just say yes or no. Let us know what it is. If it's your city or state, let us know which one it is. We're curious to know. I will circle back to Selma just for a couple of those responses in a few moments. Now, if any of you were paying attention on Sunday, you saw this too. We saw that Dr. Anthony Fauci said that the pandemic has made racism simply undeniable. We can no longer afford to just shift this racism conversation to the side or kick it under the rug. We know that racism affects health outcomes. So what is our response going to be? What is your response going to be? This webinar is one step in the right direction, but as you see from here, Dr. Fauci is saying it's going to take decades to undo what has been done through racism. So begin thinking about what opportunities may lay for your organization, for your community, to undo the harm that racism has done. And chances are what you hear today is going to really be thought-provoking. You're going to want to unpack some of the things that you're hearing and process it. So I'm pleased to share that there will be an exciting opportunity after the webinar to do just that. We're going to hold an interactive discussion group to deepen your learning about some of the concepts and just what we're saying today. Now, some of you have been part of these discussion groups in the past, so you know that these conversations give you a chance to be face-to-face with other webinar attendees, and you can share what you're doing locally as well as ask questions of the participants. We are pleased to be able to offer these discussion groups in partnership with Healthy Places by Design. And Joanne Lee, who is joining us on the webinar today, is actually going to facilitate the discussion group. And I will also let you know that Dr. Canady, Jana, and Jennifer are going to join us as well. So please take a moment to check the chat at near the end of the webinar. because someone's going to chat out that information about how you can join. And if you don't have anything else on your calendar, you're going to want to spend that time with us. So Selma, what are we hearing in the chat from folks?
Yeah, across country, Sacramento County, California has declared racism as a public health threat. San Diego County, we have City of Albany, New York. And then of course we have right here at home, Racine, Madison-Dane County, Milwaukee County, yes. Arlington County, Virginia, and the greater DC area, rural county in Oregon. So we are cross country with all of the declarations.
You know, that's so encouraging to me. And thank you so much for placing that information in the chat, folks. This has been a long time coming, and Selma, who works closely with communities that have made such a declaration, knows that. So I'm glad to see that the number of jurisdictions that are making this bold declaration is growing. So thank you so much for sharing. And now I'd like to ask Dr. Canady to join me back at the podium. Dr. Canady has been a leader in this work, supporting communities that are making declaring racism rather as a public health crisis. And so, Dr. Canady, the first thing I want to do is just ask you what's probably circling in a lot of people's minds is, why does declaring racism as a public health crisis matter?
Yeah, great question, Erica. And I will say that saying it either declaratively, you're speaking it, or sort of talking the talk, or chalking the talk, simply becomes a platform then for action. And I do want to say that this is not all or nothing. Most of our models in the way we've done our work does not fold into that. So you can actually walk the talk without having made the declaration. So I just want to say that if you're living in a jurisdiction that has not done it, if for whatever reason they don't want to do it, okay. Given that, then how are our actions going to still represent the importance of battling racism as a threat to health? And so where you have done it, it's only as good as the paper that it was written on or the voice that it was spoken from, if you are not then translating that declaration into action. We talk about dialogue as a methodology of action, not just, oh yeah, we're talking about this, we're having a conversation about this. There are lots of verbal exchanges that lead to nothing. So that's why it's really important. The declaration is important because it leverages action if it's done well.
Absolutely. And I know you have been in the public health discipline for quite some time, and you've been a leader in this work. How have you seen the dialogue around racism shift over time? And what is it about this moment in history that makes it different than what we've seen in the past?
Mm-hmm. Yeah, I've been in the game a while. It's kind of funny for me to do the math, and 30 years plus watching what we're doing. So when I first was working in local public health, well, my first job in local public health was during the AIDS pandemic, and we were having a tough time getting people to talk about the impact of racism, stigma that was a result of racism, and it was really we were comfortable talking about, not even disparities wasn't the word then, the need for cultural competence or multiculturalism, or we would talk about stigma, but we just weren't comfortable using that racism word. And so we have made progress. I mean, if you think about the fact that public health as a profession was created to assure the conditions necessary for good health. That means we have to battle conditions that impede good health. And that's stuff like classism, gender oppression, racism, all other types of oppression. And so we are now just very gently moving ourselves from that cultural competence, multiculturalism, disparities. When I was a researcher at Michigan State full-time, we thought we were really doing something. I, matter of fact, had a federal fellowship as a health disparities researcher, and we thought we were doing something. And we didn't realize that we weren't affecting change. We were simply describing and analyzing the problem over and over and over again. And so now shifting the discourse, the dialogue, to the causes of the inequities. My colleague, Richard Hoffrichter, who recently retired from NACCHO, he said, can we stop talking about social determinants of health and start talking about social determinants of health inequity, which gets us to the actual causes. And so much of our work at County Health Department was about how do we transform public health back to its root causes, because that's where we were created. That's why we were created as a profession. And then we just kind of wandered, into these categorical forests. And yes, we're doing TB, and this is the only money we have. We'll do maternal child health. But this opportunity now, and who can say why this was the leverageable moment? Why Rodney King's assault by police officers decades ago was not the tipping point? Why this was, maybe the cell phones. There are lots, we can do all types of analysis, but we absolutely are now in a moment. But I keep challenging people, seasons are long, but moments are fleeting. And we will just continue to walk around in the wilderness of this season if we don't hold ourselves accountable to acting.
So well said. I actually took that public health journey along with you when you're talking, because I have been, I've been in the field, not approaching 30 years, more like 25, but I absolutely remember when, you couldn't use that word, that R word. And so we have really come a long way in explicitly naming racism as a contribution to poor health outcomes. But it is because of leaders in the field like you and courage. And so we appreciate everything that you've done to bring us to help, bring us where we are in the dialogue around race. One other question I have for you, because I know that you've been very intricately involved in changing how the Michigan Public Health Institute operates, the values and the practice, the culture. You've been instrumental in that. And I realize that culture change takes time, but tell us how you've managed to integrate this fundamental declaration into the values there at the Institute and the way you all do business, like just public health practice in general. Mm-hmm.
Yeah, I always tell the story that when I first came on board 8 years ago, I knew that I wanted to drive us straight toward health equity work. And so I'm like, let me reach out to philanthropy, try to get a grant to get some funding to get a center started on health equity practice, right, doing. And after several rounds, one of the leaders at the foundation reached out to me and said, Renee, here's our hesitance. We know that you do this work and you are committed to this work, but you are now leading an organization that is predominantly white, that has no history of successfully doing this work. How are you going to succeed in that context? And it was such a provocative question. But I share it with you because I know many of you live and work in environments that don't have a history of doing this work. And so I'm a medical sociologist by training, and in that frame, an incrementalist. But what I realized is that even incremental change can happen rapidly. If you think about baby steps, they're small, but those toddlers scurry, man, they move quickly. And so what are the intentional things we're going to do? And so I knew initially core values were going to be really important, not because we just wanted nice words to put on our website, but when we had conflict or difficulty or trying to set priorities that I could push people to, how does that contradict our core value of health equity and social justice? Each of our core values would have an internal facing application and an external facing application. Servant leadership is very much about an equity thread in how you do your work. And so we kept pushing. As we began to do hiring, I had to think about, what does my executive team look like? Now, I'll confess, I could have a senior leadership team full of all brilliant, doctorally prepared Black women, because I know a lot of doctorally prepared, brilliant Black women. But I also had to walk the talk. How am I making sure that members of my workforce and my community see themselves at the table? And so we were able to transition that leadership team, which was predominantly all white under the prior leader, to one that also has white staff, has Black staff, has Lebanese staff, has, where is the representation? And not just even among the white staff that I have, it's not about demographics, but what are their philosophies? I can find Black folk that don't understand social justice, that don't believe they've experienced racism. That is not the type of, if I can say, Black person I want to hire. I don't want to hire white folk that aren't aware and knowledgeable and have been doing their own thinking. And so we've got to get out of sort of check the box mentality and be deeply authentic, right? I always say that we're not the generation that's getting sprayed with fire hoses and attacked by police dogs, but we are the generation that slowed down on the race. We acted like we were at the finish line, and we were nowhere near the finish line. And so it is now time for us to pick up our baton, each of us, Black and white together, as the song said, to really advance change. And so we just continue to push. I hire leaders that buy into the philosophy. They hire leaders that buy into the philosophy. They hire leaders. And so we see this less from a hierarchical place, but from a relational place. So equity at MPHI, and I would submit where you are, is not just what we do, it is how we do what we do.
Yep. Oh, thank you so much for that. I mean, if I snap anymore, I'm gonna lose my fingers, but thank you so much, Dr. Canady. Again, Dr. Canady will be joining us in our discussion group. So, you just might want to come after hearing her talk. So I appreciate that. I'm going to invite your colleague back to the stage right now, Dr. Canady. I'm going to invite Jana. Jana, I'm going to share this lovely slide that you have. And I want to ask you a question. Mm-hmm. Let's start with, Dr. Canady talked a lot about changing those values, changing how you do business, if you will. Mm-hmm. But I want to ask you, what's required to do that? What's required in terms of the capacity and the will and the readiness to address racism as a public health crisis?
That is so loaded, Erica. I'm gonna do the best I can. But as Dr. Canady was just alluding to, public health is foundationally and historically rooted in social justice. Some of our major advances in health status were based in coordination between public health actions in conjunction with social movements like housing and factory codes. When we think about the 8-hour workday, abolition of child labor and minimum wage and those type of things, many other things that also happened. So foundationally, I believe that public health is positioned to address health as a justice issue. We are positioned to mobilize communities for improved conditions. That is what we do. And as you see on this screen, I just circled a couple of things from this framework. We love a good framework in public health. And it's really important to think about these essential public health services. I think about this, so I'm probably bringing some people back to school, literally, because I remember learning about this in school, and I remember going into community, working at a local health department, and realizing when I started actually working in communities with residents, there was a disconnect. There were things that kind of were missing when we thought about frameworks and evidence-based programming. So, it is our responsibility to think about leaning into the will, because position-wise, we're there, we have the capacity, I think we have the resources. We need to lean into our will, because when there's a will, there's a way. And we can lead that way because we're not just strategists, we are catalysts. Now, this picture you see here is the 10 essential public health services that describe public health activities all communities should be undertaking, right? And this was released in 1993. So we've been using this for 25 years. However, in case you didn't know, last year in September 2020, and I invite you all to go check it out. It should be in your resource guide after this. There is a new and improved framework. So sometimes we can't just get rid of the frame altogether, although it can cause some structural enclosement. Sometimes we have to think about reframing. So if you see all these things on your screen, and I don't have time to go through each of them, we've got equity in the middle now, because now we're trying to move from these downstream approaches to upstream, right? And when we think about Healthy People 2020, between 2010 and 2020, we were looking at social determinants of health. How are we easing out of that and thinking more deeply and intentionally about equity? And equity really can't exist without justice. In order for everyone to thrive and have optimal health, which is a human right for all, we have to acknowledge the inequities, and we have to acknowledge how they've come to be. And so when we think about this framework here, we've got declarations, right? And we've got, let's use these things, let's leverage these things. We got this new framework. How can we get together and have conversations that support this updated framework and how we move forward?
Yeah, so cool. And thanks for reminding me about the frameworks. You're right. We always have frameworks in public health. But I want to ask you, now that we do have this new one, like how have the requirements shifted? Like what's required now? Other than we see equities in the center. So that's definitely a requirement, but what else?
The truth is, people have been doing this work for a very long time. Dr. Canady just shared, her experience, and I know so many other leaders, scientists, scholars that I've been following since I was an undergrad. I've only been in public health for about 20 years. But I've literally been thinking about this when I met Dr. Kamara Jones' research, and it's been swirling in my mind ever since. I just didn't know if I could say the word racism or how to articulate it. Right. What was the history? I didn't have all the knowledge. And so we need the staffing, the funding, the time. We need to prioritize the internal work that it takes to shift cultures. So how do we do that if we don't have it directly in our curriculums right now? Because I think that's changing. We work around that. We increase our awareness and knowledge. That's crucial to ensure a diverse, skilled, and competent workforce. That is one of our essential functions here on this screen. We do this by workshopping, continued training for learning, and also unlearning what hasn't worked for us. Right. How can we be innovative and creative? Who took imagination out of our work? We've really got to think around these barriers and be more creative about the knowledge exchange and how we share that dialogue. That dialogue is information for us to move forward. So many people's experiences are not in our textbooks, and that is knowledge. And oftentimes, if we're not proximate to certain problems, there's things we may not understand. So I think it's important. And I heard Jennifer say yesterday that culture eats policy for lunch. And I've heard that in so many spaces. And I would say even for dinner and breakfast and snacks sometimes. So it's important to understand that systems change requires people to change. So foundationally, we are ready. I think we just need to have that will. And I think this is the movement. This is the moment right here. Let's go beyond the paintings on the murals on the street and the declarations.
And community engagement is such an important part of this work. So how does it fit into not only public health practice, but more importantly, equity and social justice work? How does
I think we've known for a long time in public health that community building, collaboration, coalition building is so important. And actually community engagement is critical to public health and intentional health, equity, and social justice. I think where the disconnect is with community engagement is how do we do it in a meaningful way? How do we not just invite people to the tables, but also give them a plate, give them some silverware, pass them some food? So going above and beyond checking the box, but really engaging folks and centering them, because nothing about us without us, this hashtag right here, which was actually first used in association with disability rights movements. And I would say shout out to disability rights movements. I think this statement came up probably in about the 80s or 90s, and it's continued to go across social justice movements. And I think what's really also important to understand here is the intersectionality. So yes, racism is an issue. And also there are other forms of power imbalances and oppression, such as gender exploitation and discrimination, and also classism. How do we use this nothing about us without us across all social justice movements and come together in solidarity? Because at the end of the day, we're all going against the same root causes, no matter what system you're working in. And so as I continue learning, growing, I think about words. Words can be powerful. They can perpetuate inequities as well. When you think of the linguistic oppression, that's a whole nother separate webinar, maybe coming one day. But when I think about the word community, I think of two words. I think of two words that are important when we think about advancing racial and health equity. I'm thinking about communication right? And I'm thinking about unity. So communication, considering accessibility. Is everyone able to understand what's going on? Are you using different forms of communication? Requires honesty and transparency. And it also includes dialogue and listening to understand. Dialogue is doing. Dr. Canady talks about this a lot, and I absolutely agree. There is so much knowledge and richness and wisdom in conversations when we're listening to understand, not listening to reply or listening to give someone something as a transaction. And then second word here is unity. I think about unity. Those most impacted by decisions are at the center of their own solutions. If you want to bring people together in unity, you've got to have communication, which is effective, and you have to center those that are closest to their solutions. You have to make sure that everyone feels heard and valued. Again, they're not just sitting at the table watching you, they're engaging. We're centering their ideas. We are not just sharing power, we are shifting power. And then lastly, humility. Let's center humanity. We are humans. We have feelings, we have emotions. That's part of life. We need to acknowledge our mistakes and apologize because there's so much we don't know. And when you don't know, you can't grow. So I think it's important to acknowledge that and try again. And it's okay to do that. And that's where the learning happens. And that's where the change can happen.
Oh, Jana, I just love this. I love how you have created this new way for me to think about community. I mean, you just gave that word new life. It's beautiful. So, you know, I can't let you go without asking you to be a little bit realistic, because we know there's challenges with this. So
Yes.
What challenges have you observed, but more importantly, what strategies can you share to help us overcome challenges?
Well, I've kind of touched on some kind of inadvertently, but what I will say explicitly here is that I think about three major things when I'm thinking about advancing racial and health equity. I'm thinking about the historical connection to present day data and present day conditions, right? Yeah. I'm also thinking about leadership. I'm thinking about the definition of leadership, the development of leadership, how intentional it is it servant leadership? But I'm also thinking about how leadership supports these efforts when I think of leadership that have power to allocate time and money, et cetera. And then also I think about relationships, not just relationships with each other, but deepening relationship with ourselves. How do we fall into these roles? Where do we sit in the social stratification of this country? You know, how does that impact our health? And so the biggest challenge, I would say, is first of all, we cannot effectively dismantle racist and oppressive systems if we have inadequate knowledge around how they were historically created in the first place. At the root, the root causes, as you can see this tree in the root, we have the three root causes that we talk about in PHI are racism, gender exploitation, discrimination, also known as sexism, and classism. And these are the three root causes. And if something is occurring at the root, we see in those, I saw that you lifted up a picture earlier, Erica, that had all these factors, and those factors are in this tree, right? So if we're just talking about social determinants of health during Healthy People 2010 to 2020, and we didn't swim beyond the surface, we have not yet got to the isms and the power imbalances. And we definitely aren't talking about how those were created in the first place. So there's definitely an understanding, shared concepts and definition that needs to be talked about. And if we're not getting in our curriculums yet, but it's coming, then we can do that in our workspaces with each other. So the biggest challenge, I would say, is lack of education and knowledge, but we can work on that together in coming together and having these continued conversations, not just one and done certification trainings, but how are we taking these things and continue the conversations after, and then being able to take small actions. And I really want to say that, you know, when I think about this overall shift from being transactional to transformational, and we hear that a lot, what does that really mean? You know, how are we transforming communities and not just having transactions with them? It requires trust. Going back to the word community, trust, which requires truth and transparency. Yeah. So there is a row of things that need to happen for us to move from transactional to transformational. And it can be small steps, because small is good, small is all. Large is a reflection of the small.
Oh, thank you so much, Jana. And I know, folks, Jana is also, again, going to be joining us for our discussion group. But thank you. I just, the nuggets of wisdom that's coming from this panel today is just exceptional. So thank you so much. And I want to move us along because I want to get you ready for your next treat, which will be Jennifer Harris. But I want to let you know that racism as a public health crisis has been on our CHRNR's mind for a while. And we did a synopsis of the communities and state, local jurisdictions that we knew about as the had already made such a declaration as public racism as a public health crisis, because we want to see how well it fits in the role of promoting racial equity. And when we did our little study and synopsis, we found some key themes. And one of the things that we found is that communities that were able to make these declarations were better positioned to leverage data and to have their multi-sector collaborative work create action plans around addressing root causes of health disparities. We also found that government accountability led to impact. So those jurisdictions that had the most impact had a system in place where the government was accountable. So I want to encourage you to check out what we learned in the synopsis. Again, the link will be included in that nifty resource guide that will be in your inbox tomorrow. But again, the last treat, the dessert, if you will, of this dinner is Jennifer Harris, who's representing Milwaukee County, and that's one of the counties that has made this declaration, and she's going to here to share some learnings from what happened when they did that. So Jennifer, thank you for coming today. And tell us first of all what we're seeing on this image at the Office on African American Affairs in Milwaukee County.
Well, first and foremost, Erica, thank you for having me here to share about Milwaukee County's journey in our centering of racial equity. In this lovely picture, I would say that's history. That is history, the true foundation, the digging in of Milwaukee County into achieving our racial equity goals and making Milwaukee County a place to thrive and grow for all Milwaukeeans, especially those that are most disenfranchised and at the end of the inequities that plague our nation. So in the picture, we have our former County Board Supervisor, Suprema Makunde Moore to the right, the former County Executive, Chris Abley in the middle, and the current Madam Chairwoman for our County Board, Marcelia Nicholson, and the former OA Director, Nicole Brookshire, really digging in. And again, that's history of them signing. We were the first governmental entity to make the declaration of racism as a public health crisis. And I can't go any further without acknowledging CHR&R and Match for being that support and helping it lift that work so we could make this declaration to go forward. So again, thank you so much, because this is, and I did the bad thing. I looked at the chat. You're not supposed to look at the chat in webinars.
I tell y'all not look at the chat.
All of the impact and everyone that's had a declaration transpire since our initial declaration. And it is a movement, and very proud that this picture encapsulates the beginning of the movement and the work forward. In the back row is a group of our partners that helped us with some of our transformative work that the county has definitely needed throughout the years. And we are here, we're here to stay, and it's moving forward now. So.
All right, I love it. And congratulations on being the first jurisdiction to make that bold declaration. That takes courage, and creating equity takes courage. So congratulations on that. I'm curious about how you managed to get elected officials, county leadership, and staff on board with such a bold declaration.
Well, it was something that we all knew needed to transpire to move our county forward. The then county executive really planted the flag in the ground and said, hey, no, this is the direction we're going in. And the cabinet and leadership was right along lockstep with the county executive, as well as our workforce. We had to, before the declaration came out, and actually should wind back and say that our office, even being in existence, is a true testament that we're centering racial equity, and we know we have things to improve in Milwaukee County. It's no small thing that this office was lifted in a very short period of time, and we stand on the shoulder of giants that helped this office be in existence. But for us now to take this declaration and the work that was leading up to this declaration to move forward, I would say that our county leadership we engage them in a bit of normalization as well as the rest of the county by really being able to have the conversation using race words was something that was newer to the county and to all industries and people throughout the nation. And so we have a phenomenal partner in the Government Alliance for Race and Equity, GARE, that let us know we have to really be able to have the conversation before you can start to change your organization, do those transformative things. You have to be able to at least converse about racial equity.
Right.
So yeah, we were able to get people on board, and a great majority of our staff has already been on board and looking for further leadership on the direction we're going.
Great. And I want to show, it was important for us to put this slide in here because first of all, folks, I know it's a little difficult to read, but that's okay because we have copies of the slide that you can get. But it was important for us to include this slide, Jennifer, because it shows what's at the heart of identifying who's not thriving, and that's data. So tell us what inspired the declaration. Was it this data that you all found that said we have to do something?
Well, I'm a Milwaukeean through and through, born, raised, educated. This is home. I left for Madison for a little bit, but came right on back to home because this infographic to the left really explains the inequities that are transpiring. And I see this in full manifestation every day. And those that are within our entity knows that these are things that our government jurisdiction has the ability to change. And so whether it starts from the difference in wage and opportunity gaps and education, who actually owns a house. Now we know who owns a house can dictate great portions of their health, who is incarcerated and rates of recidivism, on to life expectancy and a trigger warning, sorry, but birth. The birthing of Black babies and brown babies are a whole world different. And we know that these inequities do not lead to a healthy life. And we're here to help change that and be the catalyst for that change, because we partner. We know we can't do it by ourselves as one county entity, that we need to partner and help everyone else realize that we all as a whole are not as healthy as we believe we are. If you take a look at and thank you for the
health factors,
the access to look at our healthy county ratings. You can see that Milwaukee County is least healthy in two major categories. And so if you look further on the bottom, and you'll see the slides where you can actually blow it up to see yourself. But if you compare us to the wild counties, Waukesha, Ozaukee, and Washington, Milwaukee County, we have 4 and more years of our lives taken away. What could you do with 4 years of your life? Right. And racism is impacting and stealing the life from individuals. So we cannot allow that to persist.
Exactly. Jana talked a little bit about the transactional versus transformative approaches to the way you do your work. I'm going to ask that we bring that over to the discussion group to dig into that a little bit more, because what I want to do in the last few minutes that we have together is to actually ask you to pick out 1 or 2 key components of the declaration and tell us how it has allowed you to do the work that's outlined in the declaration.
And so depicted on the slide are the major tenets of our declaration. And if I had to just choose 2, it's like choosing of your favorites. If I had to choose 2, I would go for fixing policies and equipping all of our employees. So in the fixing of policies, of course, toolkits are being in development and guidance. Reference books are being developed at key decision-making points that they'll be implemented in. One of our larger things that was implemented was our racial equity budget toolkit, where we have the ability to center racial equity in our budgeting. And I can talk more about that later. But the larger strategic plan, the county hasn't had a strategic plan in 25 years. Like, a lot has changed in 25 years. And so now the centering of racial equity is at the helm of the strategic plan. So this is going to not be that transactional, here we said, no, this is transformative. This is cutting those policies and moving them forward. And beyond that, the normalization, equipping our employees and other jurisdictions around us really normalizing the conversation so our staff can understand, and further supporting not just with trainings, but capacity building and culture. And Jana said it already. Absolutely love that. We need to reference that culture will eat any strategy at all. So we acknowledge, and I give kudos to Mbutu Research and Design and the Effective Communications Coach that reiterates this to us often, that we need to amend our culture and grow our culture so it doesn't take our strategy down.
Nice, so true. That's part of that, like you said, the practice, the norm, values create norms, and norms create practices. So it's all got to shift. Now, one thing that happens when we see transformational change is policy change. And I know that our audience would be curious to know how this declaration has influenced policy, if at all.
Well, I would definitely say, I mentioned just a few seconds previously, the Racial Equity Budget Toolkit, that every department has to answer and go through our toolkit, and it's made public. If you go to our PSB website, our performance and strategy and budget website, you can see all the responses from the departments. And really, they are forced to center racial equity in their spending and then plan forward. So this is not just, hey, check box. No, we're changing how we operate. And one of the larger things that transpired in terms of legislation would be Chapter 108, the Racial Equity and Health Resolution/Ordinance. And it's really a year later after the declaration is really meant to bolster and continue that momentum that the declaration inspired. I have read through it again this morning. It's very close to my heart, and it really, it put out there that we know we need to change our workforce to be reflective of Milwaukee County so we can render the services that are needed and be the great steward of county resources that we know we can and should be. So there's been a lot of change, but those are the two major changes.
Well, thank you so much, Jennifer, folks. And you're hearing from the very first jurisdiction to make this declaration. So thank you so much, Jennifer. And we appreciate that you're going to spend a little bit of time with us in the discussion group. Believe it or not, guys, Jennifer's off to another presentation, like almost within the hour. So, but she is going to spend a little bit of time with us, and we so appreciate that. I'm going to ask James to launch a poll because I'm curious about how your understanding of this declaration and how it can support changes in practices and policy has increased. How has your understanding increased? This is an anonymous poll. It really is just a gut check for the producers here, the two teams, Match and CHR&R, to see if we kind of hit the mark with what we did. But just let us know. It's an anonymous poll. We're not going to share the results, but I'd appreciate it if you do that. And James is going to leave that open for just a moment. And then he's going to close it, but we're not going to share those results. But I'm going to move on because one thing I want to do is share a resource with you. I'm hoping that you feel inspired to take action, but you might be asking about where do I begin? So I want to encourage you to consider CHR&R's Equity Action Learning Guides as a starting place. These guides blend guidance and tools and hands-on practice to support you in deepening your learning around equity. A link to the guides will be included in, yeah, you've already guessed it, your resource guide that you will get tomorrow. And also equally important is Match's Racism Declaration Action Toolkit. This toolkit organizes or includes rather resources that can support your organization in signing on to a racism declaration. The cool thing about this is that you will become part of a community of practice that Selma coordinates. And so you get to see more of her, but you'll also have a support of other communities doing this kind of work. Now we're running a little short on time. I am going to ask Joanne to ask Jennifer one question that I know was bubbling up, and then we're going to shift the rest of the questions on to the discussion group.
Thanks, so Joanne, yeah, the webinar presenters did such a wonderful job. I can tell from the questions that it's really got people thinking. So real quick, Jennifer, for you, you did such a wonderful job of painting the picture of Milwaukee County's story and all that you were able to do And I think folks are really interested in hearing what have been the most significant and tangible impacts you've seen in Milwaukee County since passing the declaration.
I would definitely say that, and thank you for the question. I would say that transparency. Transparency has been the largest takeaway, tangible thing, because the government entity itself can seem mystifying. It can just seem like there's something going on, smoke and mirrors. But no, this is truly the funds and resources for our county, to support our county. And we want to ensure that racial equity is centered in the use of that funding. And so now with the toolkit and having it transparent on our website, you can kind of connect the lines directly into where we're going and our plans for the future. Beyond that, the declaration truly let us take a pause and assess where we are and what we want to do. So I know our Department of Health and Human Resources has a no wrong door policy that's coming forward based on us taking that pause and understanding what is truly needed for our community. So we have a lot of initiatives underway, and we look forward to updating you in the future.
That's wonderful. Thank you so much, Jennifer. I think your Milwaukee County government has certainly demonstrated the willingness to be transparent, but also there's a level of humility in working in partnership with community. So thank you. I know, Erica, we're running short on time, so I'm going to turn it over back to you.
And I know you're heading over to the discussion group. We will see you in just a few minutes. So let me go back and ask everyone out in our audience, please, if you would take a moment to click on the link that Selma is sharing right now. She's sharing a link to a full webinar survey that I want you to take later. Don't worry about doing it now. Just click on it so you'll have the survey and then we want you to know that we take your feedback seriously. It's one of the ways that we're able to determine if we are providing content that really meets your needs. So I'm asking you to please complete that survey later, and I'm thanking you in advance for doing it. As you heard me say earlier, this is the first webinar in a two-part series. Next month, you are going to hear from these powerhouses, and Jana is all excited about Jonathan joining us. I know I'm excited about these three guests, and I want to encourage you to go ahead and register for that webinar. The registration is already available on our CHR and our website. So we're going to be digging into that term narrative. I'm sure you've heard of it, but what are narratives? And more importantly, how can we transform them so that we're able to create racial and health equity? Those are the kind of questions we're going to dig into next month. So I encourage you to go ahead and sign up for that webinar. CHR&R has a presence on Twitter and Facebook, but the real way, or the best way, I should say, to get information about our new tools and resources, as well as our webinars, is to subscribe to our newsletter. So make sure you do that as well. So that way you'll always be in the know about what's coming up and what's happening with CHR&R. We gave you a lot of tools and information today. It's going to be included in your resource guide, but I know sometimes you just want to talk to somebody as a thought partner. So I want to let you know that in addition to the tools and resources on our website, you can actually connect with a team member to have a conversation about what it is that you're doing and make sure that you're on the right track. Anytime you want to do that, just simply reach out to us. You can reach out to us by going to our Contact Us button on the CHR&R website. And now I want to invite you to join us in this discussion group. And Selma's chatting out the link right now. So I hope to see some of you over there. But I want to thank you for taking time out of your schedule to be a part of this very important discussion. A special thanks to Dr. Renée Canady, Jannah Bierens, and Jennifer Harris for just sharing these nuggets of wisdom with all of us. And as always, thank you to our production team at Match and CHR&R, and to you, the audience, for taking an hour of your time to spend it with us. We appreciate you. I will see you in the discussion group, and I will see you next month on June 15th. Have a good afternoon.